Welcome everyone to Motivational Interviewing 101, Theory and Overview of Techniques. I'm Dr. Aaron Norton. I'm a licensed mental health counselor and a licensed marriage and family therapist, and I hope you'll enjoy this video as much as I enjoyed creating it. More importantly, I hope you find it informative and useful in your everyday practice. Here's a little about me and my experience in the field of mental health and substance use treatment. I have 20 years of experience incorporating motivational interviewing into my work, and I'll refer to motivational interviewing as MI for the rest of this video. I'll tell you more about how I got started with MI in a moment. On the left side of the screen here, you'll see an email address that you can use to reach out to me if you have questions about what we're about to cover. Speaking of what we're about to cover, here's our agenda for this presentation. First, we'll define MI and describe some of its characteristics. Next, we'll discuss the rationale for the development of MI and its purpose. Why did the founders of MI create it? Third, we'll cover the theory and philosophy of MI. I strongly believe that we have to understand the true spirit of MI to use it effectively with clients. Once we got a basic understanding of the theory and philosophy of MI, we can learn about techniques, strategies, and interventions, and I'll offer real examples from my own sessions with clients over the years. We'll then discuss some of the limitations of MI, and I'll share a few resources that you can access to learn more. Let me tell you about how I was first introduced to MI. Here, you'll see my ID badge from my first position as a substance abuse counselor. Proof that I was once young, and also that I was in my 20s in the early 2000s when, apparently, frosted bleached tips were supposed to be cool. I worked in a long-term intensive residential substance use treatment program that was primarily funded by the Florida Department of Corrections. The setting I worked in was a modified therapeutic community. Clients would typically be transferred from the county jail to this program for a 16-month treatment program in lieu of a more lengthy prison sentence. Clients were all young adults between 18 and 24 years of age, with the exceptions of a small number of 16 and 17-year-old clients who had been adjudicated as adults. Many of them had been arrested many times already, and some of them had been diagnosed with antisocial personality disorder or a variety of other disorders, in addition to one or more substance use disorders. In that setting, counselors commonly used guilt or shame as a tool for recovery. For example, we had something called large group, where a client who needed to be confronted for some kind of inappropriate behavior would sit in the middle of a room with the entire community of clients surrounding him, and staff and peers would then use a variety of confrontation techniques to try and convince the client of their wrongdoing or of their character defects. Some people described this approach as tearing someone down in order to build them up. We also had something called homeless status. A client who was being sanctioned for violating rules might have to carry their belongings in garbage bags and then go from dorm to dorm at night, begging for someone to take them in. Each day, treatment staff would determine which dorm would allow the client to sleep there that night, instructing all other dorms to turn the client away. Such confrontational approaches seem to work well for some clients. After all, many of the staff who worked in that program were former clients from many years ago who found the treatment to be helpful. But honestly, for the majority of clients, the approach did not seem to work so well. The more staff tried to force clients to accept the need for change, the more some clients resisted. Clients would often be very tight-lipped in their counseling sessions, and there certainly was an us versus them mentality on campus. Then something changed. There were significant budget cuts on the state level, but a federal grant was introduced that could help fund the program, with a catch. All of the staff had to be trained on motivational enhancement therapy, a therapy that incorporated motivational interviewing into its approach, and the staff had to start using MET with their clients. What struck me about my week of MET training was that clients were invited, but not required, to train alongside their counselors, and to my surprise, many of them chose to do so. As we learned the principles and techniques of MET together, we got to role play, and sometimes my clients would be role playing as me, and I'd be role playing as them. It was a very different dynamic than I was used to in that setting, but I liked it. I noticed that once I started practicing MET, my clients started opening up more, and the entire atmosphere in that program seemed to change almost overnight. I was loving it. So, what is this thing called motivational interviewing? How do we define it? Let's shift to an overview of what MI is and what it is not. MI was created by William R. Miller, Emeritus Distinguished Professor of Psychology and Psychiatry at the University of New Mexico, and Stephen Rolnick, an Honorary Distinguished Professor in the School of Medicine and Cardiff University in Wales. MI is an evidence-based method for promoting change and growth. It is a particular way of talking with people about change and growth to strengthen their own motivation and commitment. It is a way of being with those who you seek to serve and a way of doing what you do with them. It's used to address health issues that have behavioral components. It's also an evidence-based approach. For example, it's categorized as having strong research support by the American Psychological Association's Society of Clinical Psychology. And it's also included in the Substance Abuse and Mental Health Services Administration's Evidence-Based Practices Resource Center. MI strongly values autonomy. Ultimately, the client is responsible for change and not the helper. The trans-theoretical model of change was not created by Miller and Rolnick, and it's not an MI model. But as Miller and Rolnick acknowledge, it's a model that is compatible with MI. I think that a basic understanding of this model can be helpful in conceptualizing the context in which MI is useful. The trans-theoretical model of change, developed by Prochaska, Norcross, and DiClemente, was the result of NIH-funded research that involved studying those who made significant healthy behavioral changes, such as quitting smoking, and maintained those changes over extended periods of time. Prochaska, Norcross, and DiClemente called these individuals change masters, and they looked for patterns and themes experienced by change masters. They developed a model of stages of change. The first stage of change is pre-contemplation. Pre-contemplation is characterized by denial. In this stage, an individual is not seriously considering the need for change. But at some point, an individual might shift to contemplation, where they're seriously considering the potential need for change and deciding whether they want to make a change. In the preparation stage, an individual has decided that they should change, and they haven't necessarily decided how they're going to go about it yet. They might have started to make some small changes or start to experiment with some things, but they're kind of getting their ducks in a row to decide where to go from here. At some point, a person shifts from preparation to action. Here, the individual is actually making significant behavioral changes. This is the stage that most people recognize as being change. And in this stage, those behavioral changes are abnormal to the person making them. They don't seem normal, and they might be difficult and hard to maintain, but at some point, sometimes maybe after several months of maintaining those changes, an individual shifts from action to maintenance. In maintenance, the person's changes are experienced as being the new normal. They've habituated to them, so now they're common everyday practice, and they get to experience the benefits of those changes, but they're also at risk for potential relapse and recycling, where they might move backwards in the stages of change if they have a slip and they don't use that slip to sort of refine their change process and instead end up cycling backwards. Having briefly reviewed the trans-theoretical model of change, here's a question for you. In which stage of change do you think MI is likely to be used? Is it pre-contemplation, contemplation, preparation, action, maintenance, or relapse and recycling? take a moment and decide which stage or stages you think MI is most likely to be used during. If you guessed pre-contemplation and contemplation, then I think you're right, especially contemplation. Why? Because motivational interviewing is used to help people explore and potentially resolve their ambivalence about change. People are most likely to be experiencing ambivalence about change in the pre-contemplation and contemplation stages of the trans-theoretical model of change, so it makes sense that a helper would be most likely to be using MI during these stages. But of course, that doesn't mean that MI might not be used at any other stage in this model of change. Essentially, at any point in which a client or an individual is experiencing ambivalence about their change, MI could potentially be helpful. Okay, so we've given you a little information about what MI is. Not much, but it's a start. Here's an important question. In the professional literature, has MI been demonstrated to be effective? Does it work? Is it helpful? And if it is helpful, is it just placebo? Or does something about MI itself seem to explain why and how it helps? Here's where I think systematic reviews and meta-analyses can come in handy. It's not too hard to find one study that concludes that a particular intervention is helpful in some way or not. But what if there are 20 other studies that concluded that the approach wasn't so helpful? And if 10 studies suggested an approach was helpful, but another 10 didn't? Were some of those studies better designed than others? Conversely, were some more flawed than others? Systematic reviews and meta-analyses help us to take a step back and look at the big picture of research on a topic. See, unlike narrative reviews, which are descriptive reviews, systematic reviews offer a comprehensive review of available evidence on a topic by using standardized, systematic methods and pre-selected eligibility criteria to reduce bias. Often these systematic reviews will include something called a meta-analysis, which is a component involving a statistical technique or a series of statistical techniques that are designed to synthesize the data from several studies into a single quantitative estimate or summary effect size. Generally, effect sizes are conceptualized as small at around 0.2, medium at around 0.5, and large if they are around 0.8, though such standards are dependent on the context in which the measure is applied. Anyone can go to scholar.google.com, a site that restricts a Google search to academic sources, type motivational interviewing and any combination of other keywords such as meta-analysis or systematic review, and then start sorting through various study results. If you do this, I think you'll be impressed by what you find. Here are some examples of recent meta-analyses and systematic reviews on the efficacy of MI for a variety of conditions and populations. Some examples include perpetrators of intimate partner violence, adherence to physical activity in breast cancer survivors, supporting medical adherence in adults with chronic health conditions, improving A1C, systolic blood pressure, diabetes self-efficacy, and physical activity behaviors among patients with diabetes via telehealth, reduction of 0.7 heavy alcohol days, 1.1 alcohol use days per month, and overall substance-related problems, except for cannabis, among adolescents, promoting physical activity in primary care settings, reducing pain among patients with knee osteoarthritis when coupled with mindfulness and neuromuscular exercises, and increased engagement and information gain from high-value detainees. So the bottom line is, for a wide variety of presenting problems and populations, meta-analyses and systematic reviews tend to show a high level of efficacy of motivational interviewing. People are often interested in whether a particular approach is helpful when it is administered over the phone or through telehealth instead of in person with the person that you're trying to help. And in this case, we even have some good evidence that MI can be helpful when it's being used in call centers. I also think it's very important to note that MI has been demonstrated to be helpful in a wide variety of populations all over the world. So many of the studies that you saw on a previous slide about meta-analyses and systematic reviews were conducted in a variety of countries, such as Brazil, Germany, Kenya, the United Kingdom, and the US. This raises the question of whether MI is internationally efficacious. I think it can be. Of course, with the advent of a wide variety of technologies that are being used in counseling relationships now, there's an interesting question about whether MI requires a human helper. Here's one study. While talking to a chatbot, whether MI trained or neutral, about smoking, there was an increased level of motivation to quit, but there was no significant benefit with the MI trained chatbot versus the neutral chatbot, raising the question of whether it really takes a special human touch for MI to be effective. And certainly I'm not going to pretend that we have that answer based on this one study, and that should be an interesting area to research in the future, especially as AI continues to develop and becomes more and more advanced over time. Now, it's very easy for a helper to judge a person who's struggling with making an important behavioral change. Oftentimes, we look at somebody and we say, don't you know that you need to make this change? It should be so obvious, and it shouldn't be so difficult as you're making it out to be. But frankly speaking, we all have our pockets of experiences in life where we're struggling to make an important change, or we feel ambivalent, have mixed thoughts or feelings about a particular change. So as we continue to go through this presentation, I'd love for you to think of a healthy behavioral change that you have mixed thoughts and feelings about, which we will call ambivalence, and that you'd be willing to use as an example at various points during today's training. Here are just a few examples. Maybe you struggled to institute an exercise regimen of some kind, or to keep it going long term. I certainly had that issue when I was a grad student, and I actually selected that issue as an area to focus on in a course that I was taking that tried to implement some of the research findings on what helps people to make healthy behavioral changes and to keep them going long term. And now, more than 20 years later, I continue to exercise daily because of the experiences that I had in that course. Another example is eating healthier. What about quitting smoking or vaping, or walking your dog regularly, or drinking more water, flossing more regularly, giving up excess responsibilities or delegating more, meditating or engaging in some kind of mindfulness activity, saving more money, or maybe getting a hobby? There are all kinds of things that we all think are a good idea, but we struggle with initiating the change and maintaining it long term nonetheless. So now let's shift to an exploration of the rationale for MI and the purpose of MI. MI's development began in 1982 with a series of discussions with a group of Norwegian psychologists and social workers who worked with people with alcohol use disorders. Here are some experiential and research findings that influence the development of MI. First, change is a process that emerges over time, often through personal interactions. Change is not necessarily one exact point in a timeline. It's a process that can span a tremendous amount of time and occurs as a natural part of life. We're all changing. Ambivalence is a normal experience when considering change. Some people confuse the terms ambiguous and ambivalent, but they are different. Ambiguous means unclear and exact, having a double meaning or not having made a choice between two alternatives. Ambivalent means both wanting change and not wanting it at the same time. Ambivalence involves thinking and feeling more than one way about the same thing. It is necessarily the client who decides whether change is going to happen. You, the helper, are not the one who makes that decision. It's important to understand the client's own experience and perspective. You cannot optimally help someone who you do not understand. It is the client and not you who should be voicing the reasons for change. Those reasons have to come from within the client, not from outside of them. Summaries, which are points in which the helper summarizes what the client is saying, are very important in MI. What you choose to ask, affirm, reflect, and include in summaries matters a great deal. Don't push back against what feels like resistance, because doing so usually strengthens commitment to the status quo. Instead, roll with what feels like resistance. Foster hope and optimism regarding the person's ability to change. Part of motivation is confidence. Hope and optimism are the stuff of confidence. Your client must truly believe that they can make a change to feel particularly motivated to do so. Now, let's talk about the theory and philosophy behind MI. You may be in a hurry to get to interventions that you can use with people you're trying to help. But if you don't understand the theory and philosophy of MI, your interventions are less likely to be effective. I've seen plenty of video footage of people who use the same kinds of interventions and techniques that are often used in MI, but they aren't truly providing MI because it's clear that they're using those techniques with a different intention and purpose when interacting with a client. And if I can tell that just from watching a video clip, then I believe that most clients would too. I should also clarify that when learning about the theory and philosophy of MI, it will be natural for you to wonder what something looks like in the room, so to speak, when interacting with someone you're trying to help. Remember, after we cover theory and philosophy, we'll get to more specific examples of what it might look like when a helper is trying to apply these principles while interacting with someone. From an MI perspective, helping should be person-centered. But what does that mean? It means that we should not focus on the deficits of those we're trying to help. The helper should remember that they're talking to a person with strengths, hopes, and relationships, and the helper is trying to develop a relationship with that real human who's making choices. The helper should strive to be curious, wanting to learn more about the person they're talking to, and they should also be humble. The helper should pay very close attention to how the person they're talking to is responding to what the helper is saying. It's not surprising that helpers sometimes have what might be called a fixing reflex, a strong natural desire to help fix something. But the helper should avoid giving in to that reflex, especially when it's premature to do so. In MI, the helper is trying to strike a balance between two extremes. The first is following. In Rogerian person-centered therapy, for example, it's thought that clients know what they need to know and that the therapist can best help by following the client's lead. On the other end of the spectrum, there are approaches for helping that involve directing the client, telling the client what to do, how to do it, educating them, and instructing them. In MI, however, the helper is neither following nor directing. They are instead guiding. The client is still walking with the helper and making decisions about where to go and how to get there, but the helper is guiding away from or towards certain things along the way. This will all make more sense when we start to get into some examples. Miller and Rolnick identified 4 characteristics of what they call the guiding spirit of MI. The first is partnership. People are experts on themselves. Helping involves a partnership between your expertise and theirs. The second is acceptance. Miller and Rolnick propose that helpfulness involves respect for and interest in the particular unique person you're serving. Acceptance does not mean agreement or approval of your client's thoughts, beliefs, or actions. Acceptance is conveyed by what you're doing. For example, judging, disapproving, criticizing, or shaming. Compassion is not a feeling. It's an intention to give top priority to the health and well-being of the person you're serving. It can be thought of as the embodiment of the ethical principle of benevolence, which means to do good through alleviating suffering and supporting positive growth. The fourth guiding spirit is empowerment. Empowerment's helping people realize and utilize their own strengths and abilities. You aren't providing them strength and ability, you're helping them to access and use their own. Miller and Rolnick identified 4 tasks in MI. The first is engaging, which involves establishing a collaborative, trusting, and affirming relationship. Engaging involves empathic listening to establish a non-judgmental human relationship. It can be thought of as an attempt to answer the question, can we walk together? Focusing, on the other hand, is an attempt to answer the question, where are we going? What shall we talk about? Here, you're not prescribing any goals for the client. You're clarifying the topics of change that you will be exploring together. Evoking is an attempt to answer the question, why would you go there? Evoking involves arranging conversations about change so that the person's internal pro-change advocates naturally get good time to make their case. Evoking includes reflecting on change talk as opposed to sustained talk, but we'll get to that later. Planning is an attempt to answer the question, how will you get there? Here, we're not telling clients what to do, but we are collaborating with them and helping them to explore their options and develop a plan for change. So, these are the 4 questions that we're trying to ask and answer with these 4 tasks. Can we walk together? Where are we going? Why would you go there? And how will you get there? When guiding a client on this journey of change, there are 4 traps to avoid along the way. If you know these traps well, you can recognize them when you're about to step into them. Or if you have, you can recognize that and then step out of the trap. The first is the expert trap, in which you assume an authority stance and proceed to solve someone's problem for them. The second is the persuasion trap. This trap errs on the side of directing. Here you find yourself taking responsibility to convince someone to do something. If it seems like you're arguing with a client about change, then you've probably fallen into this trap. I like to use the signal phrase, yeah, but, from my client's mouth as a sign to me that I have somehow fallen into the persuasion trap and now we're sort of arguing something back and forth. If you say something positive about change and they respond with, yeah, but, then you've probably fallen into this trap. The third trap is the time trap. Maybe you feel pressure to move the change process along quickly. Maybe you're focusing prematurely on getting to the next step. Ironically, falling into this trap can delay change. The fourth trap is the wandering trap. The people that you're trying to help will sometimes understandably love to spend time talking with you. It can feel so good to feel heard and understood, and for some of them, it might have been a long time since they've truly felt heard and understood by somebody. But if you notice that your conversations wander from topic to topic, wherever the client heads, it's probably time to clarify what you hope to do in this helping relationship. As a side note, in my opinion, this trap is an example of how MI is different than Rogerian person-centered therapy, even though there certainly are some overlaps in approach. Now let's talk about what MI is not. Let's dispel some myths about MI. It's not just being nice to people, and it's not identical to Rogerian non-directive therapy. It's not a technique or an intervention, or even a set of techniques and interventions. Remember, it's a way of communicating and being with people as you try to help them. It's not a solution to all helping situations. It's not appropriate for every scenario in which you might be helping somebody. And it's not a comprehensive theory of change like you might say the trans-theoretical model of change is. It's also not an approach that requires the use of assessment feedback. Some people might believe that to be the case because they're confusing motivational enhancement therapy, or MET, with MI. But remember, MI is a hat that you might wear for only a few minutes with somebody in a particular interaction, and you may or may not use any kind of assessment or provide feedback. You can, and Miller and Rolnick certainly seem to see some value in that, but it's not necessary to do MI. And it's also not a way of getting people to do what you want them to do. It's not some kind of a Jedi mind trick or a tool of manipulation or coercion to try and get people to do the things that you want them to do. I've seen online, by the way, some demonstrations of people doing MI on YouTube, and they'll be using interventions and techniques from MI, but while they're using these interventions and techniques that might be similar to what people would use when they're providing MI, they're not doing MI, because it's pretty clear that what they're doing in these clips is trying to get people to do what they want them to do. So now, having given you a little bit of introductory information about MI, including answering questions about what it really is and whether it's effective or not, and what it is not, and what the spirit and philosophy of MI is, we can now move on to some techniques, strategies, and interventions that can be used when somebody is providing MI. As so often seems to be the case with evidence-based contemporary models of helping people, the founders of MI seem to really like acronyms. Here's one for us: OARS. OARS refers to 4 communication skills that can be used when engaging clients. Much like the oars of a boat, they can help you to make progress on your journey. The first is open questions. Open questions are questions that cannot easily and quickly be answered with just one word or a short phrase. Those are closed questions. An example of a closed question might be, have you drank within the past 30 days? An open question might look something more like, tell me more about your drinking and what it's like for you. People tend to share more information when asked open questions. Your second communication skill for engaging is affirming. There are 2 types of affirming. A simple affirmation involves noticing or commenting on something specific and real that a person has said or done that reflects a strength. Here's an example. If I had asked the open question, tell me about your alcohol use and what it's like for you, and a client offers a lot of information in response, then I might say, it sounds like you've thought a lot about your drinking. If, however, I noticed that when talking about their drinking, there's a theme of the client being concerned about how their drinking affects others, I might say something like, I experience you as being very conscientious. You seem to care a lot about how your actions affect others. That's a complex affirmation, because I'm not affirming what the client has done or said per se. I'm affirming an admirable trait, the client's conscientiousness, Reflecting involves giving information back to the client that the client has given you, but we'll talk more about that in a moment. Summarizing is a collection of reflections. For example, after 30 minutes of discussing a client's thoughts and feelings about whether to quit vaping, I might summarize a series of things they've said by saying something like, "You've thought a lot about what you don't like about vaping, including health risks, the expense, and the sense that you need something in order to feel normal. And you've thought a lot about past attempts to quit vaping, what you think worked well and what you don't think worked so well. You're not exactly sure when you're going to quit, but you think it needs to happen soon, and you're trying to decide what you'd like to set as a quit date." From an MI perspective, motivation can be thought of as part importance and part confidence. Question is, how important is it to this client to make a particular change in their life at this time or in the near future? But another question is, how confident do they feel that they could make it if they decided to? Somebody could be low in either importance or confidence and struggle with motivation. One intervention that could both help with assessing where the client's at with their level of motivation and with trying to help them to enhance their level of motivation is called using a ruler or scaling. There are two questions you can ask a client to get a sense of where they're at. The first is, on a scale from 0 to 10, where 0 is not at all important and 10 is the most important thing in your life right now, how important would you say it is for you to make this change? The client might give you a relatively low number, like a 1 or a 2 or a 3, that might suggest that they do not see it as being very important. Or they might give you a fairly high number that suggests to you that they find it very important to make this change. But then there's a second question. On a scale from 0 to 10, how confident are you that you could do this if you decided to? If the client gives you a high number for importance but a low number for confidence, then this could help you to better understand why it is that they're struggling with making a particular change. Because it really only takes either importance or confidence being low for a client to struggle with motivation. After using the ruler, you can group a client into one of 4 categories in your mind. Group A clients express a low level of importance and confidence, so they neither see change as important nor believe that they could succeed in making such a change if they tried. And for them, you'll probably be using techniques and strategies that help them to build that level of importance and that level of confidence. Group B clients are low importance, high confidence, so you don't need to spend a lot of time affirming their ability to change. Instead, you can spend that time helping them to identify compelling reasons to change. Group C clients are high importance, low confidence, so for them, you don't have to spend a lot of time helping them to get into touch with why they think change is really important. Instead, you're going to be working on confidence building with these clients. And Group D clients are high in importance and high in confidence. You might not be doing any motivational interviewing with them at all. Or if you do, it might be very limited because they're already sold. They have a high level of motivation and they might instead be ready for an approach that's a little bit more strategic in nature. Resistance is speech that signals movement away from a particular kind of change. Frequency of resistance talk correlates with higher relapse rates. In MI, resistance talk is referred to as sustained talk, meaning statements that support the status quo. They sustain not making a change. Change talk is the opposite, statements that support making a change. If the client says something about the disadvantages of the status quo, then they're engaging in change talk. This might include, for example, talking about how expensive the use of an addictive substance has gotten. Change talk may also include the advantages of change. For example, a client might tell me, if I quit smoking, I'd probably start exercising like I did the last time I quit, and then I'd finally be able to lose some of this weight. Intention to change means that a client is saying that they plan on changing, whether now or in the future. Optimism about change is when clients talk about how they can change. They're saying something that suggests confidence that change is possible. Not surprisingly, the characteristics of sustained talk are diametric opposites of change talk. Clients might talk about what they like about the status quo, what they wouldn't like about changing, or they might talk about not wanting, intending, or planning on change, or they might communicate a lack of confidence in their ability to change. In MI, we will tend to focus more time and effort drawing out change talk than sustained talk. The more time the client spends engaging in change talk, the better. Now, I mentioned earlier that I will use some real case examples for illustrating some of these concepts. So here's a good case example. This was an adolescent male client required by probation to see a counselor, and the client's talking about what brings him to the appointment. He says, "I think it's stupid that I'm here. I'm sick and tired of all this. I'm tired of my parents getting on my back, tired of SROs and probation and all this, tired of having to talk to people like you. F that. All I did was smoke a little weed. I wasn't messing with anybody. I was minding my own business. It wasn't hurting anyone. It's just a little weed. Everybody does it. Everybody in my school does it. My teachers do it. You've probably done it. Who hasn't? It's legal all over the place. It should be legal here too. I mean, I know it's legal for medicine. How's it okay as medicine but not okay for me? People have been using it all over the world for centuries, and it's done no harm. I mean, I know I can't just do it for the rest of my life, but it's helping me a lot. It helps me study more. It makes me creative. When I smoke, I feel good and nothing bad happens. It's a plant. It grows in nature. It can't hurt you. It's all natural, organic. It's good medicine. George Washington smoked weed. People are sitting around complaining about weed when they're drinking and popping pills. It doesn't make any sense. Hey, do you think that if I just get a medical card, I can smoke it? Can you get that for me? Okay, so does it look to you like this teen is interested in change? Are they engaging in change talk or sustained talk? Is there any change talk here? What's interesting is when I work with a live group of participants on this training and I launch a polling question, most people say, no, this is sustained talk. This is not a kid that wants to change. But I don't think that's true, actually. I think this kid has handed me change talk on a silver platter. They wrapped it up and gave it to me. It's a golden opportunity, actually. There's definitely some change talk in here. Just look closely. If you look closely and you listen closely to clients, they'll give you change talk. If you give them the right environment, then they're very likely to eventually start throwing some change talk your way. And the trick is being able to see it, to notice it when it comes. So look closely. There's at least 2 examples of change talk in this paragraph. Okay, so here are those 2 examples of change talk. The first was, I'm sick and tired of all this. I'm tired of my parents getting on my back, tired of SROs and probation and all this, tired of having to talk to people like you. F that. The client here is talking about disadvantages of the status quo. They're saying that there are things that they do not like about not making this change. Now, it might be true that the client doesn't think that these are disadvantages of cannabis use directly. They don't think it's necessarily the substance or the plant cannabis that's creating these problems. But they are telling you that they are experiencing a lot of problems that are connected to their cannabis use. There's something they do not like about the status quo. Second, this client said, I mean, I know I can't just do it for the rest of my life. That communicates or infers an intention to change. when I heard this, it was really interesting to me. See, there's this old Sesame Street song, "One of these things is not like the others." This statement is not like the others, right? This was a rare gem in a large pile here of statements. And it really piqued my curiosity, because this client just got done telling me how awesome this plan is and how it's great and everybody should be doing it all the time, and if they did, the world would be a better place, right? And then all of a sudden they say, I can't just do it for the rest of my life. Well, if there's nothing wrong with it, then why can't you just do it for the rest of your life? This is an interesting statement to make. So later on, I'm going to talk to you about what I did with this change talk. But for now, we'll move on. When I introduced the acronym ORS, I said that we'll come back to reflection. So here we are, back to reflection. So here are some examples of reflective responses. Simple reflection is a simple acknowledgement of the person's disagreement, feeling, or perception. You're just basically acknowledging verbally what they have just said to you. Complex reflections offer a guess about what the person means. Here you're not exactly sure that what you're saying is accurate, so you're trying to find out. You're going to see if the client will correct you. An amplified reflection involves reflecting back what the person has said in an amplified or an exaggerated form. This could be a paradoxical technique, depending on how you're using it. And double-sided reflection involves capturing both sides of ambivalence. I used to call it developing discrepancies, but it is, you've heard contradictory statements about something. Maybe they just now said two contradictory things, or maybe they said something now and 30 minutes ago they said something contradictory, or maybe it was 2 sessions ago, but either way, you're reflecting back to them both of those statements that they've made to see what they do with it when it's brought out into the room. So here's an example of an amplified reflection. The client says, now I guess I should build a little bit of context here first. This was a client who was mandated to participate in outpatient substance use treatment connected to a DUI charge. And in order to get their driver's license back, they'll need to successfully complete treatment. And by the way, one of the requirements of that treatment is that they maintain abstinence, sobriety from alcohol and other drugs for a minimum of 3 months. And they're just now learning this during their intake appointment, and they're not happy about it. So the client says, "What? I can't drink while I'm in this program for 3 months? The Super Bowl's coming up. You mean I can't even crack open a cold one and enjoy the game? Man, I should be able to sit there while I'm fishing and enjoy a beer or two. That's relaxing. I'm under all this pressure, and now you want to make things worse for me. And I can't go out with my buddies every now and then and have a few? You're really going to isolate me like that?" Okay, right? So this client's clearly not happy and certainly expressing that discontent. So I'm going to show you here both a simple reflection and then an amplified reflection. The simple reflection part is the counselor responding by saying, "You're feeling frustrated and singled out. The rules of this program just do not seem right or fair to you." Now, the amplified reflection would be, "If I'm understanding you right, you don't think you could possibly enjoy things like the Super Bowl, fishing, or even the company of friends unless you're drinking. Without alcohol, you can't relax or have fun. You believe you need to drink in order to enjoy life." Now, what makes this an amplified reflection? Because the client didn't actually say that. They didn't say that they can't enjoy or relax without alcohol. They just said that alcohol helps them to enjoy and relax. So, what will likely happen with this amplified reflection is that the client will correct the counselor. And then the client will start assuring the counselor that they can relax and they can have fun without alcohol. And if they do that, then guess what? They're engaging in change talk. And that would mean that this counselor, by using an amplified reflection, had helped to trigger or bring out that change talk from within them. The client will now be able to talk about how they can have fun and relax without alcohol. And the more they talk about that, the better. And the counselor might respond by providing a lot of reflection and asking questions for clarification, and really try to increase the amount of time that the client spends talking about or engaging in this change talk. That would be really good to do in this case. Now, some people say, well, what if the client didn't correct the counselor? What if the client said, exactly, that's exactly what I'm saying. I can't relax and have fun without drinking. Well, wouldn't that be good for you to know anyway, that the client believes that? I mean, that would be a really important thing to know as a helper. That would tell you that the client has a low level of confidence that they could weather through stressors and discomforts of life without alcohol. And it would also tell you that they would have a very hard time having fun without drinking. And that would mean that when you focus on some kind of confidence building approach, you'll have to take that into consideration. So even if it backfired, so to speak, that's still good information to have, and it's probably great to have gotten it from the client. So here's an example of a double-sided reflection. Remember that client who we talked about a couple slides ago, the 14-year-old who was being mandated to see a counselor because of cannabis use? And remember how I said that there were 2 points where he engaged in change talk. One was when he talked about the disadvantages of the status quo, and the other one was when he talked about the intention to change. So I'm going to show you a double-sided reflection here. And before we do this, just as a little side note, when I'm listening to clients like this one, I have this interesting tendency within myself to really want to correct historical inaccuracies. So he talks about like George Washington smoking weed, for example. And I know that this is kind of a myth perpetuated by drug culture, and there's really no evidence that George Washington ever did so. He did grow the cannabis plant, but he also wrote in his journals that he thought that the female plant was useless and threw it into the river, and that he would only harvest the male plant for fiber, for clothes and nets and ropes and that sort of thing. So obviously wasn't using the female bud, and there's no evidence anywhere that it ever occurred to him that one could use this for some kind of a high or euphoria. So it's just kind of one of those myths perpetuated by drug culture. But remember that in MI, we're not going to be arguing with clients about things. So I'm going to let that statement just pass on by, and I'm going to try to focus more on highlighting change talk. So here's a double-sided reflection I used in response for this client, or something like it. You've experienced several benefits to smoking weed. You know a lot of people use it. It's been used as medicine for centuries. It seems to help you a lot. And it seems safe and all natural, especially in comparison to alcohol and some of the pills that people are prescribed. And at the same time, you're tired of getting into trouble over and over again because of your marijuana use. You're tired of the tension between you and your parents, brush-ins with the law, and you don't think you should do it for the rest of your life. So I'll pause here and say, I still summarized or reflected back to him, summarized back to him all of the things that he said that are sustained talk. I did that at the beginning of my double-sided reflection, and then I ended the double-sided reflection with the change talk statements. Because what is he most likely to respond to now? He's going to likely respond to the change talk. And the more that he engages in the change talk, the better. You're trying to maximize the amount of time that clients spend engaging in change talk. So the client did tell me, kind of educated me a little bit about why he didn't think that he could just use it for the rest of his life. I acted kind of confused by that statement. And he said, well, I mean, it's smoke. And, smoke can't be good for you for the rest of your life. I mean, it goes in your body and it irritates things and creates problems. And So I summarized that back, or reflected that back to him. But then I asked a follow-up question. I said, well, but I'm curious, what if it weren't smoke? What if instead you were like using gummies or maybe vaping or something? And he responded by saying, well, there are other things that make it bad besides smoke. And he talked about, like a lethargy or a laziness that people will get sometimes, and that he understands that it creates some kind of cognitive or brain damage over time. And so he's now educating me about adverse health effects of long-term cannabis use. So sometimes that's how a double-sided reflection might help to steer or guide the client towards change talk. I didn't tell him these things. The information's already inside of him. I'm just creating the condition where it can be accessed and brought into the room. So remember earlier I said that you can use the ruler either as a screening tool or you can use it as an intervention. Well, let's talk about how it might be used as an intervention. Let's say that you ask the client the importance scaling question and they give you a low number, maybe a 3. If you wanted to find out what their barriers are to importance, then you could ask them, well, what makes it a 3 instead of an 8 or a 9 or a 10? But if you did that, then they're going to respond by giving you sustained talk. They're going to be telling you why it's a low number. And remember, intervention-wise, you might instead want to focus more on trying to solicit change talk from them. So if you wanted to solicit change talk, instead you would ask, well, what makes it a 3 instead of a 0 or a 1? Whatever they respond with is likely to be change talk. They're going to tell you why it is important, not why it's not important to them. And when they do that, you're going to ask lots of questions and you're going to be interested and reflect things back to them, because the more time that the two of you spend engaging in that change talk, the better. But same is true for the importance question. What if a client gives you a 3 for importance? Well, if you ask them why it's a 3 instead of an 8 or a 9 or a 10, you're going to find out what their barriers are to feeling confident that they can make a change. But if instead you wanted to solicit change talk from them, you'd ask them, well, what makes it a 3 instead of a 0 or a 1? And then when they respond to that with change talk, you'll reflect things back, you'll ask questions, you'll be a curious explorer who wants to hear more and learn more about this, and you're going to maximize the amount of time that the two of you can spend on that change talk. Here's a case scenario, a case example of me using the ruler both for assessment purposes and then second as an actual intervention. So a vocational rehabilitation counselor referred a client who we'll call Robert because he repeatedly talks about how badly he needs to get a job, complains about not having one yet, verbalizes frustration that his job coach and his vocational counselor aren't doing enough to help him, but he often fails to follow through with agreed upon homework like researching openings or filling out or submitting applications or showing up for a job search class or drafting a resume. And he's even turned down a few job offers for what sound like strange and obscure reasons. So suspecting that there's an issue with motivation, his counselor refers him to me for motivational interviewing. So what did I ask this guy? I asked him, on a scale from 0 to 10, how important is it to you to get a job? And he said a 10. And I did lots of follow-up questions and reflections with him, and he talked a lot about why it was so important to him. So then I moved on to the second question. How confident do you feel that you could get and keep a job? And he said, oh, a 1. So this told me that the reason people were confused is they were focusing on importance, but no one was really exploring with him the confidence issue. Remember, motivation is part importance and part confidence. So I raised the question, right? And at first, I just wanted to find out what the barriers were to confidence. So I asked him, well, what makes it a 1 instead of a higher number, or is like an 8 or a 9 or a 10? And he said, just look at me. I'm morbidly obese. I'm sweating just because I walked from around the corner, your lobby, to this room and sat down. I couldn't fit in most of the chairs that you have in your lobby. Any employer is going to take one look at me when I walk in for an interview and say, this guy's not going to be able to work. He's not going to be a hard worker. And you know what? They're probably right, because I don't think I can physically keep up unless I do something about this weight. Now, I asked him what he thinks it would take for that number to climb from a 1 to a 5 or a 6 or a 7. And he said, I'd have to lose 50 pounds. I think I'd have to lose at least 50 pounds to truly be employable. So I did something a little different in this case. I next asked for him to rate his level of importance and confidence for losing 50 pounds or more. He gave a high number for importance, a 10, and again a low number for confidence, a 1 on a scale from 0 to 10. So this is a client who thinks change is very important, but he lacks confidence. And I'd gotten permission from his vocational counselor to spend some time focusing on that. So I did. I focused on trying to use motivational interviewing for the area, the focus of losing 50 pounds or more. I'm going to tell you more about the strategies then that I used to help build that confidence in just a moment. Let's talk about more interventions now. Some responses that go beyond reflection. Here's one called shifting focus. This could be a useful strategy when a client's engaging in resistance talk. Here's a real example. Client says, I know how this is supposed to go. You're going to tell me that I'm an addict and that I need to stop or I'll die or something. You're just going to lecture me and tell me how much of a screw up I am. Well, you don't really want to validate that statement, because this is a client who's coming in and he's ready for a fight. He's putting the boxing gloves on, right? Maybe he's done this before with other counselors and he kind of knows what the routine is. He's been in treatment that uses a more confrontational approach. I responded by saying, whoa, I'm in no position to tell you what you should and shouldn't be doing. I just met you, but I would like to get to know you more. Maybe we could start off with you telling me about what brings you here today. Is that okay with you? So I'm going to sidestep the argument. I'm not going to engage with him in some kind of an argument about what I am or am not going to do and what he should or should not do. Remember, we need to engage first. We need to help him answer the question of whether we can walk together. Here's a second intervention that goes beyond reflection. It's called reframing. Many of you who are into cognitive behavioral therapy know all about reframing. And you know that you can take a picture and you can really change the way that that picture looks and feels just by changing the frame that it's put inside of. So the same is true for reframing in an MI perspective. In addition to reframing, there is a technique called agreeing with a twist. It is essentially a reflection followed by a reframe. So the only difference between a reframe and agreeing with a twist is that you throw a reflection in before you reframe. So let me show you an example of that. The client says, gee, you guys sound just like my wife. She's always nagging and complaining about my drinking. Like it's a crisis for me to crack open a beer and blow off a little steam. And then she nags and she nags and she just goes on. And the next thing you know, we're going to bed pissed again. She complains about everything, my drinking, my eating. It just never stops. Now, I started off with a reflection of what he was saying. Your wife very frequently complains about your drinking and your eating. And this often leads to arguments and going to bed angry. But here, I'm going to end my reframe, or my reflection, with a reframe. She's so worried about your drinking and your health that she's willing to endure a great deal of conflict to address it. So here now, I'm kind of reframing her as being complaintive and argumentative as her caring. She's complaining because she cares enough about your health to do so, and she's willing to do that even though it's going to end up becoming a fight. That is how much she cares. Another response that goes beyond reflection is emphasizing personal choice and control. Let's show you an example of that one. Here the client says, "The truth is that none of you can make me stop drinking. No one can. If I'm going to stop, it's going to be because I want to, not because someone made me sign some paper or something." Now, this is an example of what in previous editions of the MI textbook has been referred to as rolling with resistance. In this case, by emphasizing personal choice and control. I'm not going to argue with the client about this because the client's right. No one can make them stop drinking except for them. And if they stop, it's going to be because they wanted to and not because somebody else coerced them. So I responded by saying, "You're absolutely right. No one can make you stop drinking except you, and you won't stop until you're ready to." For our next response that goes beyond reflection, we'll talk about coming alongside. Now, this one's interesting. It is a paradoxical intervention, and I suggest using it sparingly and reserving it for those clients for whom you've established a clear and consistent, maybe like a naysaying kind of a pattern. They're the yeah but client. Hopefully you've got good rapport built up with them. I think there should be some caution in using this intervention, but it can be very helpful, very powerful sometimes. So let's give you an example. Dante was a 25-year-old male diagnosed with schizoaffective disorder, gender dysphoria, and avoidant personality disorder. He was referred by vocational rehabilitation because of his lack of follow-through with job search activities, and then abruptly quitting a job that looked like a perfect fit. He was referred by VR for MI in hopes of resolving his ambivalence about employment. I found myself talking to him, and I was trying to sort of honestly problem solve. So I definitely stepped outside of the MI role in this session. I fell into a trap. Remember those 4 traps from earlier? And in this particular trap, I was trying to convince him of something that he could do for work. So I was bringing up some examples of things, and then he'd kind of shoot them down, and some of the shooting down responses were kind of contradictory. For example, he said, "Well, I really want to work with video games." And I said, "Hey, what about a place like GameStop, where they sell video games? You know a lot about video games. I would think you could be really helpful in answering questions that people have, and you might really like the employee discount you can get there too if they have one." And he said, "Oh, no, I can't do that. Most GameStops are in a busy plaza or a mall where there are too many people, too many sounds, it's too loud, and it complicates my social anxiety too much. I can't do that." And so then I said, "Okay, well, what if instead it was a job where you were like in a back room, kind of working by yourself independently, like maybe doing graphic design or something like that?" And he said, "Oh, no, I can't do that because if I'm too isolated, then I'm not going to have enough structure, and I really need somebody to be there that kind of shows me how to do things, and I don't want to get too isolated because that can have me feeling depressed." So you can kind of see how there's this sort of Goldilocks phenomenon where everything's just a little off and nothing's quite just right. And then it struck me, we're in the yeah but kind of phase here, which tells me that I have stepped outside of MI a long time ago. And now I'm trying to fix things, and not surprisingly, it's not going very well. So I needed to step out of that trap and do something different. And then I realized something. No matter what I say, he's going to figure out a way to shoot it down. So maybe I should just come alongside him. I mean, if we're to be honest about it, I've come up with all the ideas I can think of, and he's done a great job of shooting them all down. So let's see what happens. So here's a statement. We made a thorough list of all the jobs that you can't do, and I'm unable to think of any jobs that you're already qualified for that we haven't excluded yet. You may be right about not being able to work. It might be better use of our time to start exploring how you can live with no income other than your Social Security check after your parents are gone. Although we previously identified that you don't make enough to live in your own apartment, we may be able to find a group home that you can live in. What would you think about touring some of them? So this is not going to sound good to him, and his yeah but pattern is probably going to continue. And so sure enough, he responded by saying, well, hold on here a second. I don't necessarily need to go to any kind of a group home or anything down the road. I'm not saying that I can't work. I'm just saying that I can't work in a job that I currently am qualified for. And so I'm going to take the position of being curious and really wanting to learn more. So I asked him to tell me more about what he means by that. And he said, well, I could go back to school. I could get a trade under my belt that I don't have right now in a job that I could work at. But I said, the last time though that you talked about going back to school, you said you didn't think that would work well because it didn't go well the last time, and the professors all wanted you to do things their way and not your way, and you didn't see the point of it anyway. And he stopped me and said, yeah, but I was younger then. That was a few years ago. And also I wasn't on medication then, now I am. So I might be able to handle it pretty well now. Make a long story short, this client did eventually go back to school, got a degree, got a trade, and started working. So it's an example of how the coming alongside approach could be helpful. Now, some people here will say, well, what if it had backfired on you? And he'd said, okay, let's go look at group homes. I don't think I can do anything else. Well, I mean, if the client is persistently telling me that they can't do anything else, and me trying to come up with ideas is going to be shot down no matter what, and the client's convinced that they really do need to focus on not working, then, maybe it's not a bad idea for them to be touring group homes. He might even find that he doesn't really want to be in one of them, and his motivation to avoid that outcome could potentially increase. We don't know. But remember, it's not our responsibility to make clients change or to convince them of the need to change or to convince them that they can do things. We can only provide the relationship and the environment that increases the probability that they'll be able to tap into that inner motivation to change. Here's some additional MI interventions that I'd like for us to cover next. The first is asking evocative questions. We're not going to talk anymore about using the importance ruler because we've already covered that pretty thoroughly, but we will talk some more about elaborating, querying the extremes, looking back, looking forward, and exploring goals and values. Let's dive in. To set the stage for asking evocative questions, I'd like to first discuss a tool called the decisional balance. The decisional balance typically involves a client creating a chart, and the chart might have a row for the change condition and a row for the status quo condition. The change condition, for example, might be quitting drinking, and status quo might be drinking. And the columns will include pros and cons. So you might ask a client to collaborate together to brainstorm as many benefits or possible benefits of quitting drinking that they can possibly think of. What are all the reasons they might want to do it, or the things that they would like about it, or what they think would be better because of it? And they list all of those things, and you'd ask lots of follow-up questions and reflect a lot of their responses back and really spend a lot of time on that box. And then the next box would be the cons, the drawbacks to change. So here you could ask them, well, what would be the downside to quitting drinking? What are all the things that you wouldn't like about it or that wouldn't go very well for you? And the client would brainstorm as many ideas as they can think of, and you would do a lot of reflecting and asking questions. And then next, we'd go down to the lower center here, and we'd ask about the benefits of continuing to drink. What are all the things that they get of value from it? And Finally, we'll ask about the cons, the drawbacks of continuing to drink, all of the negative consequences, the aversive experiences, the things that they don't like or think might not go well in the future if they continue to drink. Now, many times I'll ask a client after we've done this chart to take a look at it and to let me know what they notice. And sometimes they'll say, well, clearly it seems like the best thing for them to do is, and they'll talk about what they think they ought to do in terms of drinking or not drinking. But sometimes they'll say, no, I still kind of feel like it's an even coin toss. And if that happens, there's an alteration of this exercise that could be helpful. You could add an additional column at the end called strategies or something like that. And you could say, I want you to imagine that you did make the change. You quit drinking. How could you either prevent some of these drawbacks, these cons from happening, or if they're not preventable, how could you best manage them? And then you would do the same for the cons of the status quo. And many times clients become aware that it would be easier to deal with one set of cons than another one. But they might also be getting some ideas for how they could build their confidence for change. Also notice that the exercise begins and ends with change talk. So at the beginning, we're talking about the benefits of change, and at the end, we're talking about the drawbacks of the status quo, the disadvantages of it. Let's now talk about evoking or asking evocative questions. Evoking involves soliciting change talk from the client. And remember, there are 4 different ways that a client can engage in change talk. The first is disadvantages of the status quo. So you could ask them questions such as, what worries you about your current situation? What makes you think you need to do something about it? What tells you that? What is it about your drinking that concerns your wife? The next category of evoking questions would involve soliciting discussion about the advantages of change. You might ask questions like, how would you like for things to be different? You might ask some variation of the miracle question, which comes from solution-focused therapy. And it goes something like this. If a miracle happened overnight such that you woke up in the morning and this was no longer an issue, what would be different throughout the day? What would you be doing differently on a day-to-day basis? You could ask questions like, what would be different if you lost weight? The next category of change talk involves optimism about change. So you could ask questions like, what do you think would work for you if you decided to change? What personal strengths do you have that could help you to succeed? What tells you that you can change if you want to? And then a 4th category is intention to change. You could ask questions like, what do you think about your insert status quo behavior at this point? What are your options? What would you be willing to try? What do you intend to do? When using MI, I think it's very important to remember that we need to spend time elaborating. When a client, for example, lists a reason for change, then you don't want to just move on. You want to spend time on that. You want to get them to elaborate and tell you more about it. Because remember, the more time they spend talking about change, the better. So you can ask for clarification. You can ask questions like, well, in what ways? Or you could ask for a specific example or a description of the last time that it occurred. Or you could say something like, what else? But you really want to try and prompt them to tell you more. Another method for soliciting and exploring change talk involves querying the extremes. This can be helpful in particular for building a sense of importance. You could ask questions like, what concerns you the most about your drinking? Or, if you changed this, what do you think would be the best that could happen? Another way that I like to query the extremes is to give I like to call it the two universe scenario. I want you to imagine that there's a parallel universe where there's an exact copy of you. But the only difference is, in this other universe, you don't drink at all. Everything else about you is the same except that you don't drink. What do you think would be different about that version of you in that alternate universe? What do you think it would look like? Looking back and looking forward can both be very helpful interventions when using MI. I'm going to start with giving you some examples of how you can use looking back or looking forward for the purpose of maybe soliciting some change talk about the importance of the change. Remember, some clients are low on importance and some are low on confidence. How do you help them to get in touch with that sense of importance about the change? Well, you might ask questions like, do you remember a time when things were going well? What's changed since then? Or what was different in your life before you started using? Or if you decide to change, what do you hope will be different in the future? Or you could use the two stories or narratives approach. I gave you an example of that on the previous slide where I like to ask about this parallel universe. But another way to do that in the sense of looking forward would be to say, I'd like for you to imagine two scenarios. 10 years from now, you aren't drinking at all. You haven't been drinking all that time. And then in another future scenario, you have been drinking. What do you think would be different 10 years from now in these two different scenarios? So you're trying to solicit from them anything that could be used to give a sense of importance for making the change. Now we're going to talk about how to use looking back and looking forward to help a client build their sense of confidence in just a moment. But before we do that, another strategy is to explore goals and values. There are lots of ways that you can explore goals and values with a client. You could ask them, for example, hypothetically, if they had a child who they cared about who were struggling with this issue, then what do they think would be good for that kid to do and why? Or if it was a good friend of theirs or somebody that they cared about or loved deeply. Or you could explore their value system in general. There are lots of tools from other approaches that could be infused in with MI to do that. For example, the epitaph from acceptance and commitment therapy, or the value directions inventory, where they're rating how important different valued areas of life are and how satisfied they are with where they're at in those different areas. Or there's a tool called the life reflection statement, where they answer important questions about their beliefs and their values and what they think is important and not about life. But sometimes getting them to talk more about their values can help to trigger some kind of awareness that there's a disparity between their values and the status quo behavior. I mentioned that I would offer an example of how you could use looking back or looking forward to help a client to tap into their sense of confidence that they could make a change. So let's go back to the example that I gave earlier of the client who was referred by vocational rehabilitation because there appeared to be some ambivalence about work. And remember, this client gave us a low number for confidence, but a high number for importance for getting a job. And he thought that his primary barrier was that he would need to lose at least 50 pounds in order to be employable. So I used the ruler to try and find out what his level of motivation was for losing 50 pounds. And not surprisingly, he had a high number for importance, but a low number for confidence as well. So how can you use looking back to build confidence? Well, first you could ask the client if there was a time in the past in which they did lose a significant amount of weight, and then try to expand how much time the client spends talking about that experience and what strategies that he used. But in his case, he said that he has never been successful in the goal of losing weight. So instead, you can then assume that because they are a living, breathing human being, they have successfully made significant changes in their lives in other areas. And maybe if they could get in touch with the strategies they use to do that, then they could perhaps transfer those universal change strategies to the current change area. So I asked him if he could think about another experience in his life in which something seemed really important, but he wasn't confident that he could pull it off. But yet somehow, in spite of all of the odds, he did it. He succeeded at this major change. And he thought about it for a moment, and then he talked about having gotten good grades in high school. I asked him what he thinks made that such a difficult goal for him, why he had a low level of confidence in the past that he could make good grades in school. And he said, well, I had never made good grades in school in elementary or middle school, and I'm not the sharpest tool in the shed, and my parents didn't care much about grades or school. They didn't think it was a priority or that school was necessary. And I had a very chaotic home life, and I couldn't concentrate or focus or study there. So I'm going to do a lot of reflecting back and asking follow-up questions about all of these challenges that made it difficult to make the change. And then I'm going to ask, well, how, in spite of all of those barriers, did you manage pulling off good grades all the way through high school? And he said, well, first I found the smart kids. There were these kids who make good grades, and I did this little tutoring and study group thing with them. And I got a planner, and I wrote down all the due dates for all of my assignments and when all the exams were coming up so I wouldn't miss anything. And so I did a lot of reflecting back and asking follow-up questions about those strategies. But I also asked, well, what about the difficulty at home? It was a chaotic home, and it was hard to concentrate and focus there, and your parents didn't really care if you did well in school. And he said, oh, what I did was I would stay after school in the library where I could concentrate and focus, or if the weather was good, I'd go to this park nearby and I would study there on a bench. And my parents didn't even know what time I got out of school, so they didn't realize that I was spending time after school studying. So I asked him if he could brainstorm how, in theory, these same strategies might be able to be used to lose 50 pounds or more. He came back to his next session and he said, well, I found the smart kids. They're called Weight Watchers, and I went to one of their meetings, and I found out that they had these meal planners, these journals where you can plan out all of your meals. So there's the finding the smart kids, or that social influence, and then there's the getting organized and using a planner approach. And then I asked, what about environment? You know, you put yourself in a different environment when you were working on making good grades in high school, and I'm wondering how you might be able to use that same strategy of environmental control for the problem that you face today or the goal that you have. And he said, well, I realize that I have lots of junk food in the house, so I decided I need to get rid of that. But if I'm going to get rid of that, then I have to learn how to make healthy snacks. So I watched some YouTube videos, and then I went to the store and I bought a bunch of supplies, and I don't even have access to unhealthy food in my home environment. So you can see how he's already a change master, but he doesn't necessarily know about that until using looking back to extrapolate, get in-depth information about the strategies that he used in the past. To skip forward, he did lose 50 pounds and more. He eventually started going to the gym, and he got a job working in a deli for a grocery department because he learned that he really enjoyed making healthy food and enjoyed becoming working in food prep. Now let's talk a little bit about some of the limitations of motivational interviewing. As Miller and Rolnick acknowledge, it's not the strategy or the solution for every situation where somebody could use some help, right? So first, while there is evidence that motivational interviewing is effective, we don't fully understand exactly how and why it's effective. I have lots of opinions about this, but we'll save that for another time maybe. It's not for everyone and for all situations. There's a specific context in which MI is provided, and that's when somebody is experiencing some ambivalence that they'd like to explore and resolve about healthy changes that have behavioral components. There are sometimes institutional barriers and funding and payer barriers to using MI. You might work in a program where you're obligated to use other kinds of approaches, some of which might seem contradictory with MI. But remember, MI is also something you can just use for part of a session. It's an approach that you could use even if you're using other methods and approaches alongside it. And there also can be legal and ethical considerations, so remember that motivational interviewing strongly values autonomy. Ultimately, the client makes the decision on whether to make a change or not, and we respect that autonomy and we don't assume responsibility for getting them to make a change or to not make that change. But what if the client were talking to you about ambivalence about whether to kill themselves tonight, whether to complete suicide? And let's say that towards the end of the session, they conclude that, you know what, I think that is the right path for me, and that's what I'm going to do. Do you just honor their autonomy? Well, of course not. You're going to have legal and ethical considerations for some scenarios where you can't fully honor or respect a client's autonomy. Finally, let's talk about a few resources to learn more. I don't think there's any better source than the founders themselves of MI, Miller and Rolnick. So here's their Motivational Interviewing, Helping People Change and Grow text. It's available on Amazon as an ebook, or you can order a physical copy. It's in the 4th edition. It was just published again in 2023, the newest edition. Pessy, a training company, offers I think it's 3-day long motivational interviewing course with one of the founders, Stephen Rolnick. That is not a free training, but it's really great to be able to learn from one of the founders themselves, and lots of great role plays in that training as well. SAMHSA has published a tip guideline that is available for free. You can download it online, and it is entitled Tip 35, Enhancing Motivation for Change in Substance Abuse Treatment. I hope you found this introduction to motivational interviewing helpful. Maybe it's just enough to whet your appetite to learn more. If you're a mental health professional watching this training online and you'd like to get a CE certificate for it, but you haven't registered yet, there's a link in the description that you can use to purchase and register the on-demand training. You will have to pass a brief quiz to get your continuing education certificate. For everyone else, though, I hope this was a good resource for you to better understand MI, and I wish you all well.